Hello, I'm Amanda. I'm the occupational therapist and certified lymphedema therapist here at Cornerstone. Today we're going to talk about lymphedema and what it is and how it's treated. So this is a little slide about what Cornerstone. It's a locally owned PT clinic that was founded in 2008. There's a list of subspecialties that we have. And if you have any questions about any of those, you can feel free to call the clinic at the number on the screen. This is a little bit about me. I graduated from DeVille College in 2012 with my master's in occupational therapy. And then I moved here and started working at a skilled nursing facility. I got lymphedema certified in 2019 and started working here at Cornerstone in November. This is a picture of the lymphatic system. It consists of multiple organs, nodes, and vessels that help move fluid from your limbs back into your circulatory system. It is considered an accessory route for fluid, so it picks up the fluid, cells, debris left behind from your venous system that gets dropped into your tissues. So your lymphatic system picks it back up, brings it to your lymph nodes where it's filtered, and then brought back into your heart and back through into your venous system. This picture here is a diagram of your watersheds and territories. It splits the body into different sections. So your right arm and chest all go to your right lymph nodes, and the left goes to the left ones. There are certain areas where it crosses, and with the use of manual lymph drainage, you can push the fluid from, let's say, your right arm swollen, from your right arm across your chest and into your left arm, where it is picked up into those lymph nodes, and then back into your circulatory system. So what is lymphedema? It's an abnormal swelling condition that's caused by a malformation or damage to your lymphatic vessels or nodes. It causes waste or fluid to build up in your tissues or in your limbs. It's different from regular swelling because it's a protein-rich edema. So the proteins come and they aren't able to be picked up by your lymphatic system or your venous system. So they stay in your tissues. So if you take a fluid pill to get rid of that swelling, it'll come back because those proteins stay in your tissues unless you help move those proteins back into your lymphatic system. So what causes lymphedema? There's two types. You have primary lymphedema, which is hereditary congenital. Sometimes it starts at birth and you might have a swollen leg, or it comes later in life, which is lymphedema tarda, which usually starts 35 years or after. You usually notice it in your legs. It's most often caused by too narrow of lymph vessels, or you have too few, which then your body can't move the fluid back into your venous system. Or you have secondary lymphedema, which is usually caused by trauma. Most often it's surgery, from cancer treatments. It could be caused by a car accident, a sports injury, a fall, or an infection. You could have a blood clot that damages your lymphatic system, or you have lymphedema, which is most often in women, and it's lymphedema is a build-up of fatty tissue that's not controlled by diet. So this is a diagram of why lymphedema develops. So you have your normal, what your body can normal handle, and then you have your normal lymphatic fluid. So if something happens to your lymphatic system, your body can handle less fluid, and then because it can handle less, the fluid just continues to build up in your tissues, and it's unable to bring all that fluid back out of that limb, and that's what causes the lymphedema. Here's another picture that shows how lymphedema develops. So if you think about a highway, and you're traveling on a highway and you hit a toll booth, and it slows down a little bit in that area, and then you go through. But if you have 3 of those toll booths closed down, then you have to try to get over, and it causes a further backup. That's kind of what happens with your lymphatic system. You have lymph nodes removed. Your body has to find a different route for that lymph fluid to move to. This is a picture of the stages of lymphedema. So that first one there is the pre-stage or stage 0. It's when you have a known insult. You've had a blood clot, or you broke your leg, or you've had your lymph nodes removed because of cancer. So you have that insult, but you don't have any swelling. You don't notice any difference in your limb. Stage 1 is when you start to notice you have, your leg might feel heavy or your arm. You might notice a little bit of swelling, but it goes down at night. It's usually worse during the day when you're up all day. Stage 2 is when you start to notice more swelling. It doesn't go down at night. It stays all the time. Your skin might start to harden. And then stage 3 is when you start to notice globules kind of develop, you might have infections, your skin might start to leak. So in the treatment of lymphedema, you can be treated at stage 3, but it's not going to go back all the way down to the pre-stage, stage 0. It's the best to treat it when you know that you have an injury, or you start to notice the swelling, which is stage 0 or stage 1. Treatment of lymphedema is with complete decongestive therapy. So there's 2 phases to it. Phase 1 involves you coming into the clinic, and I do manual lymph drainage, which is a light touch massage that pushes the fluid from your swollen area into healthy lymph nodes and back into your venous system. And then there's bandaging, which is the use of short stretch bandages, and padding that provide a low pressure when you're doing nothing, and a higher pressure when you're doing activity, walking, exercise. And the reason why it does that is because if you're exercising, your muscles contract against the bandage and then pushes fluid back out of that area of congestion, which is why the 4th bullet point, exercise, is important, because fluid moves from your lymphatic system with the use of your muscles. And then skincare is also important to help reduce the risk of skin breakdown and wounds and infection. The next phase is phase 2, which is more your home management phase. So you get an exercise program and you will wear a compression garment that it provides compression against the exercise and helps the fluid move back through the body. And then you will do your home self-MLD or manual lymph drainage. And if that's too difficult, we can look at getting you a pneumatic pump. If you have any questions, feel free to type them in now. My name's Amanda. I'm an occupational therapist here at Cornerstone.